Namaskar and a very warm welcome to the 21st edition of the Phone In program. I'm Nidhi Kumar and you're watching India Science. The second wave of the COVID-19 continues to recede in all states of the country. In most states of North India, cases have been falling at more than twice the rate, and a decline is seen in the south, Maharashtra, and even in Delhi. In this phone-in program where you can ask your questions live, we take your queries live. So today we are joined by none other than the very eminent Dr. Anupam Sibal, Group Medical Director, Apollo Hospitals, Group and Senior Consultant, Pediatric Gastroenterologist and Hepatologist, Indraprastha, Apollo Hospitals. Many thanks for joining us today, sir, and thank you so much for sparing your valuable time.
Thank you so much, Nidhi ji. It's a privilege to be a part of your program.
I would like to begin, sir, by asking you about the Delta variant, sir, which is believed to be the Indian variant, as some may even call it, or the variant behind the second wave of the COVID-19 SARS-2 virus. It is also still the most dominant variant here in India. Please let us know more about this variant, sir.
Well, I think the first thing I'd like to clarify for our viewers is that this whole thing about what's a variant, what's a mutation. So, any change in amino acid means there is a mutation. Now, if we look at the number of mutations in the spike protein itself of the SARS-CoV-2 virus, there's several thousand of those. When the mutations change the structure or the behavior of the virus, we call it a variant. And variants can be a variant of interest, where we want to study more and learn more about it, or we could have a variant of concern. And WHO will call a variant as a variant of concern if it is more infectious in that the transmission rates are higher, or if it produces more serious manifestations, more complications, more hospitalizations, or it is smarter in that it either evades the effect of the vaccine or treatment. Now, there are several variants of concern that we have learnt about over the last few months, reported from different parts of the world. And one particular variant is the variant you alluded to, which is the Delta variant. What we know about this variant is that it is now a dominant variant in our part of the world and is also being seen in many other parts of the world. It does seem to produce a higher incidence of infection among contacts. And of course, there is much more that we need to know about this variant of concern. The other thing that I'd like to add about the variant of concern is that there were some concerns that will the vaccine work against this variant of concern? But we have some data from Apollo Hospital, Delhi. We studied 3,235 healthcare workers, and we followed them up after a single or two doses of the Covishield vaccine. And we found that 85 out of those 3,000 plus, which roughly works out to 2.6%, got infected. Only 2 required admission, which is 0.06%. And when we looked back, so clearly the vaccine prevents, and we looked back and we found that the Delta variant was present in 47%. So despite this variant being present in a substantive proportion of our workforce, only 2 individuals required hospitalization, no ICU and no death. So clearly the vaccine works against this variant, and this is very positive news, and it's been seen in data from other countries as well. Nidhi.
Thank you so much, sir. We're joined by our first caller, Ramesh from Kolkata. Namaste, Ramesh. Welcome to India Science. Please ask your question.
Namaste, ma'am. Namaste, sir. So my question is, how vaccines work against the different new strains?
So Ramesh ji, thank you for that question. So basically what happens is that we have different types of vaccines using different technology and have a slightly different mechanism of action. So you'll have the inactivated whole vaccine, which is the Covaxin. You have the mRNA vaccines that are the Moderna and the Pfizer. Then you have the adenovirus vaccines, which is Covishield and Sputnik. And there are many other vaccines that are being studied. I mean, there are about 183 in preclinical studies that the WHO has listed, 100 in clinical studies, and 19 vaccines have been or are in the process of examination by WHO for licensing. So what we will see as we get more and more variants, we will have to perhaps adapt some of the vaccines should there be a need. And let me give an example. Every year, the WHO comes out with a list of viruses against influenza that are dominant in the world. And based on that, the companies manufacture the vaccine, and this is then sent to different parts of the world and administered. So at this point in time, what we are seeing is that the available vaccines are protective against the variants. Of course, there might be slight variations in the degree of protection that they offer compared to the original studies that were done in the phase 3 trials or phase 2 trials when we did not have the variants. But that does not mean that these vaccines won't work. But to improve the efficacy of vaccines, it is very likely that the companies and the scientists developing these vaccines will perhaps look at modifying vaccines to suit what is circulating or what is the dominant variant, and then produce a vaccine that works against that variant. So this is going to be an evolving space, and let's see how it pans out. But the good news is that the existing vaccines do provide significant degree of protection against the variants.
Absolutely, and thank you, Ramesh, for joining us. Keep joining us for more such queries. We're now joined by another caller, Suresh from Kerala. Namaste, Suresh ji. Welcome to India Science. Please ask your question.
Hi. Yes, thank you. First of all, thank you for bringing out such an important information on COVID-19. My question is that how COVID-19 impacts gastrointestinal, and what are gastrointestinal symptoms associated with the virus?
Thank you for the question, Sureji. So let me just address this in two age groups. So in the first phase or the first wave in pediatrics, we had classical manifestations, fever, cold, cough, not feeling well, and of course loss of smell and taste in a certain proportion of children. But what we've seen in the second wave is that we've seen a significant proportion of kids present with gastrointestinal manifestations. So diarrhea and vomiting, tummy ache. Then in children, we also have MISC, which is the multi-inflammatory syndrome in children, which typically develops 4 weeks after recovery from COVID, where the RT-PCR is negative, but the SARS-CoV-2 antibodies are positive. And this is an inflammatory response. And sometimes children can have severe abdominal pain as a manifestation. And of course, there are a variety of other manifestations. So GI symptoms in COVID are very well known, even in adults. You can get a variety of symptoms. Some of them develop later, after the acute manifestations are over, from tummy ache to bloatedness to acidity to constipation. So a variety of manifestations have been well described. And as we have learned over the last, nearly 500 days, that this virus has manifestations everywhere. And, a variety of symptoms can be produced involving the different systems, and sometimes you get a combination. And so one has to have an open mind when one is dealing in today's environment of individuals presenting with vague symptoms that, could this be explained by the SARS-CoV-2 virus or not?
I hope that answers your question, Sureshji. Thank you for joining us. We have yet another caller, Meenal from Nagpur. Namaste, Meenal ji. Welcome to the program. Please ask your question.
Namaste, Nidhi ji, and I would like to ask my question from the doctor that, doctor, what is MIS.C, which stands for multi-inflammatory syndrome, where it came from and how rare is it?
Thank you, Meenal ji. It's a very important question you have asked, because in the last few weeks, there's been a lot of media attention on MIS.C. Having said that, this was first described in the Caucasian population last March, April in Europe. And the manifestations initially in a subgroup was like what is known as Kawasaki's disease. It's a condition that we've known for decades, first described in Japan, where you get very high fever, you can get redness of the eyes, the tongue, you can get swelling of the lymph nodes, and there could be heart manifestations. So there was a Kawasaki disease-like manifestation, and there was, of course, other manifestations with just high fever, not like Kawasaki, or involvement of the GI system, or the patient becoming very unwell, getting dehydrated, going into shock. So MIS.C is the term we now use for it. It's uncommon. It's seen in less than 1% of children who have the COVID-19 infection. Typically presents 3 to 4 weeks later, and typically starts off with fever, high fever, 103, 104, and if it continues for 3 3 days or more, we start thinking about it. We usually wait for 5 days to confirm the diagnosis. The SARS-CoV-2 antibodies are positive. There are certain other markers that are positive, like CRP. And sometimes you can just have fever, sometimes you can have fever, and the child can be very sick with low blood pressure and getting into a very critical situation. And sometimes we can see a Kawasaki disease-like presentation. The good news is that these children can be managed with effective medication, which sometimes involves the use of intravenous immunoglobulin and steroids. And depending on the specific case, we adjust what medication we need to give and for how long.
I think that's beautifully answered. Thank you, Meenal, for joining us. Doctor, if I may ask you another question that is flashing on our YouTube right now. If we talk of Apollo group of hospitals, how many children are you seeing coming in with these symptoms or, with the anti-inflammatory syndrome, as you just said?
So we have, 71 plus hospitals in 16 states of India. So what I can give you is a sense of what we saw in the second wave. We saw a significant number of children who presented with fever, cold, cough, or GI manifestations. The vast majority of them did not require any hospitalization. And let me hasten to add here that if you look at the NCDC data till 7th of June, we've seen as many as 11.77% of all confirmed COVID cases being in less than 20, about 3.36 in young children less than 10, and then 8.4 in the 10 to or 11 to 20 age group. So, it's about 12%. So it's not that, we haven't been seeing COVID in children in the first wave. But obviously, if the numbers are 4 times as we saw on 9th of May compared to 16th of September when the first wave peaked, obviously the number of children will also be more. So pan-India, this is what our pediatricians experienced. We saw more cases, but the vast majority of them were fine, mild symptoms, managed at home by video. Very few required physical examination and very, very few required hospitalization. As far as MISC goes in the second wave, for example, in Delhi, we've had about 20 children come in who've required therapy. So the numbers are not very large at all, considering that, we're dealing with a very large population base and a significant number of children have had COVID. So MISC continues to remain as an unusual, uncommon presentation of COVID-19.
And touch wood for that.
Absolutely.
Let's hope it goes away totally. We're joined by another caller, Kuldeep Mathur from Surat. Namaste, Kuldeep ji. Welcome to India Science. Please ask your question.
Hello, ma'am. Hello, sir. Sir, my question is, how high is the risk of black fungus among children? What steps should be taken to secure our children now that the lockdown is easing in most parts of the country?
Thank you for that question. Just like MISC received a lot of attention, so has Mucor received a lot of attention. So let's understand what happens. What happens in an individual who has diabetes is that if their sugars are all over the place and are not very well maintained, there could be ketoacidosis, which allows the mucor really to thrive. If steroids have been used in high doses and for an extended period of time, and if I were to use the term inappropriately, then the sugars can go high. So you have high sugars, you have ketoacidosis, which provides an environment for the mucor to thrive. And then you have ferritin, which is produced by the SARS-CoV-2 virus, which again is good for the growth of mucormycosis. So you have this combination, and sometimes you have immunosuppression in terms of the immune system has been suppressed with the medication that we have used, and that's when you get mucormycosis. It's a very uncommon manifestation in children, and I don't think we should get worried about it. You have to have all the other building blocks to be present for this to surface, because mucor is present in the environment. It's very common. So the question is that the individual should have what it takes for the mucor to thrive, which is, you have the infection with COVID, you have high sugars, you might have acidosis, you might have had steroids which have made the sugar worse, and you might have been on immunosuppressive medicine. So if you look at the pediatric scenario, this doesn't happen. I would say it happens very, very rarely. So please put your mind at rest and not worry about mucor.
Thank you, Kuldeep, for joining us. We have one more caller who's been calling us from Surat, and I'd like to take that question now. Sandeep Mathurji, welcome to India Science. Please ask your question. I think we've lost the call. Doctor, there is one more strain in Nepal and Vietnam. This is a YouTube question. Let us also know about these strains. What would you like to say about these?
So the variants will continue to emerge. We saw a variant we saw in Africa. We saw a variant in Europe. We saw a variant in South America. We are seeing this variant in Southeast Asia. So variants will continue to emerge. What is important is for it to be, is it a variant of interest? Is it a variant of concern? And if it's a variant of concern, what type of concerns do we have? So I think this is going to be a space which is going to evolve. We are going to see lots of variations in the structure of this virus because it's going to continue to mutate. And we just hope that it mutates and becomes less infectious and reaches a stage where it does not produce the clinical manifestation. So that's also a possibility. So I guess this is a subject of intense study. And samples are constantly looked at and reviewed for genomic analysis to see what the structure is, and we will continue to learn more about this science as time goes by.
Absolutely. We're joined by Sandeep again. We'd like to take him now. Sandeep ji, please ask your question. We lost you last time.
Hi. So I got my first dose some days back, and now the second dose is not available. Second dose of the vaccine. So what will that be an issue if the gap between the two doses increases? And my another question is that how can I protect myself between these two doses of vaccine?
One second, so Sandeep, you got Covishield or Covaxin? You didn't say that.
Covishield.
Okay. So the question here is that what is the purpose of the second dose? The purpose of the second dose is to boost the immune response that has been triggered in the body with the first dose. Now, if you look at the Pfizer and mRNA vaccines, they've been given very quickly, 3 weeks to 4 weeks. If we look at the Oxford vaccine, from 4 weeks to 12 weeks. So there are a lot of different options available in terms of the second dose. I would not worry about the gap between your first and second. You have significant amount of protection from the first. Let me tell you that, because when we looked at our data for 3,300, nearly 3,300 healthcare workers, we found that the single dose also provided protection, which was very significant, and there wasn't much of a difference between two doses and one dose in terms of infection, which was overall at 2.6% or hospitalization. So please put your mind at rest. Once your turn comes, please happily go and get the vaccine. And whether it's a question of protection after the first or even after the second, you will continue to have to follow SMS. You continue to have to sanitize, have the mask on and maintain social distancing. So just because you've got the second dose does not mean that you can go ahead and, not get concerned or not adhere to the protocol in terms of protection. And that is something that I want to reinforce. We also see that after the second dose of the vaccine, people get the sense of, I've been vaccinated, I'm okay. Yeah, sure, you're okay and you have a high degree of protection, but that does not mean that you have 100% protection. So you could get an infection, and therefore, please maintain all the precautions. And SMS is here to stay. So whether you had the first dose and even when you get the second dose, please don't forget about SMS is my submission.
Absolutely. And thank you so much for that very well answered question, Doctor. We are joined by another caller, Akash from New Delhi. Namaste, Akash. Welcome to India Science. Please ask your question.
Namaste, ma'am. Namaste, sir. Sir, I have a question. What is long COVID? Why are people having cardiac issues with long COVID?
You see, when the symptoms continue for an extended period of time, we refer to it as long COVID, because we thought that, it's like an acute respiratory, predominantly respiratory condition. So, once you recover your cold and your cough and your your chest symptoms decrease or disappear, you're fine. But what we are noticing is a variety of manifestations that individuals continue to have. These could be related to the respiratory tract. They could be related to the nervous system, GI system. and it could be related to mental health issues in terms of issues with behavior, or it could be related to fatigue. So we are getting a large number of combinations of symptoms in long COVID. And yes, there are issues with thrombosis, and I might as well address this issue because quite often this has been asked, the risk of thrombosis with the vaccination. So that is about what 7 to 9 per million, and the risk of thrombosis with COVID is about 35. So it's several times the risk. And that is why, the risk benefit ratio is go get vaccinated and not worry about thrombosis. So yes, cardiac events are being reported, and that is why it is important that individuals who recover from COVID are monitored depending on their risk factors, depending on what they might have had in the past, whether they had any history of coronary artery disease or high blood pressure, or were they on statins. In that their health is monitored. If there is a need for tests, they are done. And very importantly, exercise should be in moderation. One shouldn't go back very quickly, because your body has gone through something very intense. So going on to a very rigorous exercise routine, which the individual was used to pre-COVID, perhaps is not something that is desirable. And so the return to exercise should be in consultation with the doctor.
I think that's one of the most important points which you put it out so subtly. The exercise should be very, very slowly increased. People are just going into the gyms and they're thinking they're absolutely fine, and hence the problems all start. Meanwhile, we have another caller with us, Diksha from Mumbai. Namaste Diksha ji, welcome to India Science. Please ask your question.
Hello, ma'am. Hello, sir. This is Diksha from Mumbai. So my question is, I've read about COVID-19 virus, that any virus infects your body, it can destroy healthy cells and make multiple copies of itself. So how does it impact digestive tract and liver issues? Can you please elaborate on this?
So, every virus does that. It multiplies within the body. So, that is not anything special or specific about SARS-CoV-2 virus. But what happens with different viruses is that they decide which organ provides them with the right environment to thrive. So there are some that sort of attack the neurological system. There are some that focus on the liver. There's some that attack the gastrointestinal system and produce GI manifestations and so on and so forth. Or some attack the heart and produce myocarditis. So what we have here in the GI manifestations, like I said, could be diarrhea, could be abdominal pain, could be vomiting, could be bloatedness, could be constipation. Dysfunction of the liver with the enzymes going up is very well described, and that could be a part of the multi-system involvement that you have, or it could be more focused on the liver. So one sees a variety of manifestations in this entity, as I've alluded to.
Thank you so much for joining us. Meanwhile, we have yet another caller, Rohini from Bangalore. Rohini, please ask your question.
Sir, please tell us about the latest situation on fungal infections, and what about the treatment?
So, as I mentioned, the risk factors, and I guess with a greater degree of awareness that we are seeing here, obviously everybody's being very judicious about making sure that we can put into effect the preventive measures in terms of use of steroids appropriately when needed for the duration in the right dose. Obviously, there's a greater degree of awareness which has resulted in early diagnosis where treatment is more successful. Typically, we had a very big conference the other day where we discussed this issue. Typically, what the experts had to say was that 3 to 4 weeks after the peak of infection, you see the peak of this. So as we are past the peak now, and things are, in fact, today is exactly 31 days since the peak, we will see the numbers go down. The treatment requires a multidisciplinary approach. So you need someone from infectious disease, you need somebody from pulmonology. It quite often involves the eye and the nasal passages. So you need an ENT, an ophthalmologist, sometimes a neurosurgeon. And together, everybody deliberates and decides on what the appropriate medication is. It usually is intravenous antifungals, in very selected cases, oral antifungals, and in a substantial proportion of individuals, the need for surgery. And the importance is that surgery needs to be done early, because the results are much better with early intervention.
Thank you so much, doctor, for taking us through this question on fungus. We're getting many questions on YouTube on white fungus, yellow fungus, all of that. We'll deal with that later. We have yet another caller, Shambhavi from Delhi. Namaste, Shambhavi ji. Please ask your question.
Namaste, ma'am. Namaste, sir. So my question is, how do I differentiate, COVID symptoms vis-a-vis the seasonal cold and flu or normal sore throat, which is very usual and common among kids? And what are the new symptoms according to you?
So it's very hard clinically distinguishing between flu and COVID. And typically you see flu when, children go out, they go to play school, they go to the park, they meet with their friends, they go to school. Now that is not all happening. They're all in confined spaces at home. At this point in time, especially in the last few weeks, our focus really has been on making a diagnosis of COVID-19 because that's been so common. But clinically, it's very hard to distinguish, and quite often when one thinks about COVID-19, it's important that one confirms the diagnosis, and if it's negative, then that's fine. But there has to be a high degree of clinical suspicion in considering a diagnosis of COVID-19 in the environment we find ourselves in.
I hope that answers your question. We have another question on the YouTube, sir, by Vivek Shukla, and he's asking that his child is showing flu-like symptoms. So what should he do? Should he go for a CT scan? Should he go for a teleconversation with you perhaps, or with some other doctor? He's a little confused.
Yeah, so if the child has flu-like symptoms, which means the child has a cold, a cough, or fever, running nose, it's important to consider the diagnosis of COVID-19, and one would need to do a test, which is a swab, a nasal and an oral swab. We do not go around doing chest X-rays or blood tests in children, and neither do we get a CT scan done. We don't want to expose children to radiation, so one is very cautious about ordering a CT. So we wouldn't do a CT. I wouldn't want any other test to be done. I would get an RT-PCR done, and I would consult with the doctor.
Sir, another question that is coming to us is that what message would you like to give to those people who have recovered from COVID, or those who are suffering from long COVID, and also how would you like to ask them to keep safe during these times, because you never know when a third wave is coming?
So for all those who have survived COVID, congratulations. You have gone through something that only you know what it means to go through. And for those with long COVID, this will pass. So please be positive. You will notice a difference every few days, every week or so, and your symptoms will abate. So be very positive. To those who've had it, there is a small risk of getting it again, so please continue to be cautious. Though, of course, one would have hoped that a natural infection would result in a situation where we would not get it again. But yes, repeat infections have been reported, so please be cautious. And that is what my recommendation would be. And also, therefore, to prevent yourself getting an infection, you should get vaccinated. And please adhere to the local governmental guidelines on that.
Thank you so much for that. And we have yet another caller, the last caller, in fact, for today. Anjali from New Delhi. Namaste, Anjali. Please ask your question. Hello, Anjali. Can you hear me? Her question is on steroids, sir. I'd like to take this from her side. She's asking on the fact that her aunt has been administered remdesivir about 3 days back. She's also named the hospital. I wouldn't like to go into that. And is showing signs of recovery. Should she take this as a positive with the view to the fact that now remdesivir has been discontinued?
Well, typically remdesivir is given for 5 days. There are very clear indications on when remdesivir is to be given. There are very clear indications on when steroids are to be given. They are to be given to individuals who need oxygen, and that's where the benefit has been. So I would leave it to the treating team, and they would adhere to the standard guidelines about use of medication, and they have given remdesivir, and I'm sure they would have made a decision about giving steroids, and and for how long. So I would not worry about it and leave it with the experts to be able to make the decision. And as long as your aunt, is in good spirits and is fighting back, and I'm sure she will make a recovery.
And on that note, cheer up, Anjali. And in the end, I'd like to thank you, Dr. Sibal, for this wonderful conversation and for joining us on this phone-in. We request you to join us on more occasions. And to all of us watching and to all the viewers, we will effectively beat the pandemic. The main weapons in our artillery are vaccination and COVID-appropriate behavior, but we also need to smartly stay away from misinformation. And please stay safe by masking up, following social distancing and getting vaccinated. On that note, this is a wrap on this COVID Phone in Live. Thank you all for watching. Namaskar.